Today, we would like to talk about the meaning of self-management with regard to more and more chronic diseases and as a prerequisite for successful self-management. And we would like to generate ideas how to implement these insights and ideas together with the patient representative and to embed it sustainably in our structures and to make sure that we have the right funding to do so. And we're going to give you food for thought how to embed it into an active life. And we're going to focus on the successful factors as well. So this is only possible because we were convinced of this idea. And one of these people is Professor Marie-Luise Dierks. She's a professor for public health at the Medical University in Hannover. And she's been a chair or a professor there since 2004. She's the co-founder of the First Patient University in Hannover since 2007. And since 2014, she was on board at INSEA since 1990. She's been working in academia, and she studied sociology as well as education. But before that, she was actually a medical staff at a hospital. So she is adding her perspective to this program, and she knows what self-management actually means. And she's going to show us this project and also the opportunities as well as limitations of the continuation of self-management programs. Mrs. Dierks, we're happy you're here. The floor is yours. Thank you very much, Mr. Kösters. I'm so happy to look around this room, and I'm just imagining who's actually watching. I see so many faces who contributed so far. I don't want this to end. I don't want this to be the final event. I just hope that this is sort of our reason to continue. Nevertheless, I would like to take you on a journey, and let's take a look back. So I talked to the course leaders, I talked to my peer colleagues, and I tried to gather their feedback on the future of INSEA, because the foundation and the BAMA might at one point decide to keep funding or not keep funding this program. So we heard a lot already. Just let me explain to you again why it is important to have this program. Mr. Schwarz already pointed it out. On the big screen, it's difficult to see. So we see that there is a large share of population that is affected by chronic conditions. And everyone is well aware of the fact that it's not just affecting an individual, but also their family members and friends. So these represent more than 58% over 65. It's also affecting their friends and family. So this slide shows the everyday life. So let's take a look at a month of someone who's suffering from a chronic condition. If I'm lucky, I don't have to spend much time with the professional system during a month. Everything that's in blue here is the time that I spend with my chronic disease on my own. And 1% is just the share I spent with the institutions. So this means that this might just be a conditional successful health. I really like that term because it represents a different definition of a chronic condition. I know I spend a share of my time with my disease, but not all of my life. And I would like to point out that self-management and a positive dealing with your resources is something that we need in everyday life. What is self-management? Let's take a look at this staircase. So this is what we're working on when we carry out our courses. This is a staircase that starts at, am I able to do that? Do I want this? What do I need to do this? I'm going to try it. I'm going to keep doing it. At the end of the staircase, I will be able to integrate it into my life. So step by step, we can achieve this. So initiative for self-management and active life were something that was actually launched from the SHI and the self-help, and we just heard it during the introductory remark. We were allowed to participate. And right now I would like to mention one person, Mr. Krug. I hope you're not upset. Mr. Meyer-Jürgen, you can't be here today, but if you're listening today, you were one of the founders or one of the ones who kicked it off together with Mr. Krug at Barmer, and you facilitated this project. Thank you so much for your support. This initiative for self-management and active life, this is what INSEA stands for in Germany. And we listed the stakeholders here. It is supported by the Carium Foundation in Switzerland. So we are present, or we're connected with Austria, Switzerland. So I'm going to explain the program to you. I know you're very well familiar with it, but nevertheless, those who are not familiar with it yet, I would like to explain to you that we are working across different diseases. This is very important when we take a look at our social health code in Germany. It's very important to know that in order to understand the weaknesses of our system. So we are serving those suffering as well as their family members. The courses are not led by professionals, but rather by those who were affected themselves. So it is a peer-to-peer approach. They are being trained. We have quality assessments as well, and Kate Lorig is also here today. She's the founder of this initiative, and she actually brought it into the world, and I appreciate it so much that she's joining us here today, and she's going to present more details later on, especially about the contents of these courses. You can see it on the right hand side of the slide. We actually convey the tools, or we transmit the tools that are necessary, and later on we're going to talk about that in detail as well. We actually also create incentives for a defined time period, and we also try to make it possible online. I know our online formats work well, but I also like the fact that we're here in person today. So we advanced this project in different regions of Germany. I'm not going to go into detail because we're going to hear more about that in the afternoon. More than 2,000 participants have joined this program over the years. We trained many course leaders or course managers. Of course, we could not invite everyone due to the COVID regulations. We carried out many courses online as well as offline. So we see things are changing. And we also managed to implement an evaluation of our program. And we can see on many different levels, we fostered the self-management literacy for many people. This is quite impressive. You can see it says T0, T1, T2, T3. T0 represents the beginning of the course. T1 is 6 weeks later. You can see that there's a significant increase, and then it remains at that level, which is impressive because usually we see that the curves go down after a period of time. But with regard to the self-management literacy, this remains as impressive, and I think that's quite encouraging.
Recht auf die Reise gemacht.
And I think it was the right thing to do to start this journey, because we would like to embed this in our healthcare system also in the long term. Well, and we haven't really found our place here, because it's a good thing. There is more than self-management, and sometimes our specific approach is part of other approaches that are already in place. But I would like to tell you more about the different stations of our journey. We have care, prevention, education and community, and self-help, and in the end it's about empowerment. So this is the very first step. First of all, we ask the decision makers whether we might link our program to patient trainings according to Article 43 of the Social Code, Volume 5. But the objective of these patient trainings are to increase commitment to provide help when it comes to changing daily routines. And of course, relatives are invited as well if they wish. And then we realized it wasn't really a fit. And I'm going to show you why in a minute, because many of us are aware of disease management programs that also include patient trainings. And on the one hand, it seems to be a good fit, integrating self-management, because this would be part of the system. Then the third idea was maybe we can have selective contracts. Well, this is more about the details of the German social code, but then at a certain point in time, we had to stop and wait because it is always indication specific. But INSEA and CDMSP is an umbrella program for chronic conditions. Well, so patient trainings are not mainly intended for relatives. And when it comes to patient trainings, you also have to bear in mind that it is physicians or doctors that are the head or the teachers of these trainings. So it was not possible to include it in patient trainings. Of course, we may ask ourselves whether we can start discussing patient trainings again and maybe change recommendations for patient trainings. And of course, we also dealt with medical rehabilitation, because this might also be an idea where our program ties in nicely. There are a lot of programs and courses that are offered to patients after they have attended rehabilitation. And we thought that INSEA might be a good fit, but again, it has turned out to be very complicated. Many different bodies would have to cooperate, and those providing rehabilitation, they have their own trainings and they think these trainings are sufficient. Then there's a third point, the prevention. Prevention is also a large part of Social Code 5, and it is also about achieving a number of objectives, but this is mainly about primary prevention, so it's not about coping with a chronic condition. Then we looked into Article 20 and we found out that, again, professional health practitioners need to lead these courses and trainings, so we don't need physicians or doctors, but still we need qualified health practitioners. Again, we could not push forward with our program. There is a new article, Article 20K, and that is the promotion of digital health literacy. So we thought, well, maybe we should not only focus on digital health literacy, but health literacy in general. So we might discuss this together. So the penultimate idea was there are countries like Switzerland where INSEA programs are funded by the employer or by the fees of those participating in these courses. Well, unfortunately, I have to tell you that this program is not particularly successful in Switzerland, and this is, I'm sure, mainly due to these factors. So I think we will not be able to do this in Germany, especially having our target group in mind. People are usually not able to pay these fees for such programs. So we think this is too difficult. Of course, we can look into communities, care centers. We already developed an idea on how to approach this. So there are plenty of possibilities, and Kate Lorick will tell us how this is implemented in the United States and in other European countries. But who helped us and paved the way? Well, this was self-help, because self-help is promoted under law. SHEs and associations, they provide funding for self-help groups, and this funding can be based on different criteria. Either there is a lump sum, one-off funding, or this is part of a project. And this is also an idea that we can discuss later. So funding of self-help that is also based on mutual commitment. There is a bigger unit within INSEA that considers it to be its mission to open up self-help and emphasize that there are additional courses, and maybe self-help can also open up, not only focusing on condition-specific training. And maybe we can cooperate with statutory health insurance associations. So there are possibilities, there are opportunities, and that's good news. And the question that we can discuss is what I've listed here, but the bottom line is, well, the big issue is whether political decision makers and health decision makers realize how relevant this problem is. Mr. Schwarzer, the patient representative, has already underlined that they are aware of the importance of INSEA, and of course we would like to provide access to this program for all people in Germany. And given the increased number of people suffering from chronic conditions, is a good illustrator how important this program is. And now I would like to wind up my presentation. Thank you very much for your patience, and I hope that we enjoy a great day, a great conference together. Thank you. Thank you very much, Mrs. Dierks. I think it was very interesting to see that we usually spend 1% of our time seeing health practitioners, and 99% of our time is where we need self-management. And that's why these skills are so important. Well, so I was also wondering, on the one hand, there are a lot of categories you fit in, but no one really feels responsible. And there's one more thing that I think was striking. Well, you developed enormous resources with 5,000 people undergoing training, and a lot of people being the head of these classes, and we will have to discuss today how we can open up more doors so